One of the concerns that I have as an emergency room physician is that people are dying more from narcotic prescription overdoses than they are from motor vehicle accidents in the United States.
Staff at Blessing Hospital recently initiated a program where doctors cannot prescribe narcotics as easily as they had in the past.
Oftentimes, if you work in a place long enough, you'll see the same faces over and over again. You start to get concerned.
It's the patient who's been in here 10 times this year and has multiple reasons for pain, ankle sprains, dental pain, abdominal pain, migraine headaches, that comes in wanting their narcotic injection, and they request their narcotics by name. These are people that really don't need to be here for that type of problem.
Dr. Richard Salborn says your primary care physicians should take care of that type of pain, not the emergency room. But ER doctors continue to see an increase with these pain-related visits.
You'll have, a physician that may refuse to give a patient narcotics, and they'll come back half an hour later, re-register, in the hope of seeing another physician who may not be aware of the problem that the patient has.
ER staff can look up patients' medical records online to see how many times they visited, but it's only a statewide system.
One of the other things we'd really like to do is reach out to the care providers in the community and to know if there are pain contracts that a patient has signed with them.
Dr. Salborn says the contract should detail the one doctor, one pharmacy that prescribes your narcotics, but many people don't sign them and go through multiple physicians.
It makes it challenging sometimes to track down, patients' patterns and see, where they're getting narcotics and how often they're getting narcotics. So if we see a pattern developing, we try to get, social manager, social care worker involved, and care manager involved, and you try to address those issues before it gets out of hand. Oftentimes people get very upset about that, but ultimately it's in their best interest.
Brooke Hash, KHQA News, Quincy.